Here's how a chiropractor may help someone with a shoulder injury after a motor vehicle accident. First, we'll diagnose the shoulder injury. So we need to know how they were injured, the direction of the collision, and then we would do simple tests like palpation, range of motion, possibly x-ray to show a separation or a tear, and if necessary, request an MRI. Once we discover the injury, we can talk about treatment. So one of the best ways to treat the shoulder is increase motion in that joint. Oftentimes it'll be stuck after a crash. And so one of the things that we can do is go ahead and put your hands on your hips, is perform, and elbow straight back, a shoulder adjustment. It's very gentle, it's very safe. The shoulder will just click right back into place. Another gentle adjustment for the shoulder is just working the scapula, the clavicle, and the humerus, and just getting some motion back in there. Patients feel a lot of relief after mobilizing the shoulder like that. After the adjustment, we'll take the patient to a wall like this, grab a lacrosse ball, and then very gently and safely, we can work all the muscles of the shoulder, the side, the pec in the front, and then around the scapula, up and down, performing different shoulder mobility exercises against that resistance against the ball. Again, increasing range of motion, decreasing that pain, the body to heal itself. And then using these vibration platforms, I may have the patient sit down, if possible, go into extension, opening up the chest and the shoulders, bringing the head back. Again, getting those shoulders back to where they belong. Within a few minutes and a few appointments, we're able to see great restoration of that function of that shoulder.
I was recently asked by Dr. Utash what was my favorite part of the adjustment, and I responded with the neck adjustment, and it's because it's the most alleviating part of the adjustment. If you think about it, it's the neck is the most crucial part of it because your brain is the key part of everything that happens in your body. It's your motor, and your neck is like your transmission unit from the brain to the spinal cord down to all your nerves in your body. So it alleviates all the pain in every muscle.
Hey guys, if you're like me, you were taught to eat every last little piece of food on that plate, and you were eating until you were full. This Mindful Monday tip of the week is eat until you're no longer hungry, not until you're full. I'll say it again, eat until you're no longer hungry, not until you're full. Dr. Joe Utash, Wellness Key Chiropractic, Mindful Monday.
What have you guys been putting in your juice? Do you want an idea of what you can put in your juice to help with inflammation, help decrease inflammation? So what you can do is you can do ginger and turmeric and then also greens. So that's all natural anti-inflammatories, help you decrease any inflammation in the body.
Hey guys, when you guys do the roll, you want to make sure that you put it at the base of the neck. You want to do this for your posture and make sure you get that curve that you're supposed to have in your neck. Also, when you're using the dinner roll, you want to start off at 2 minutes and then work your way up to 20. You also want to make sure that it's right in the center, that it's not like this, not like that. It's right at the base of the neck. And you want to make sure that your neck melts in and your chin is up.
Hi, here's 3 quick tips to help you have a successful day of juicing. So the first one is pick your day that you're going to do it. Make sure that it's a busy day. For me, it's either Monday or Thursday. Number 2, you want to plan out your juices. Pick 5 or 6 juices that you're going to have and have them ready for the day. So do 1 for each meal and then another 1 in between your meals. And then third is drink water in between each juice. I know it feels like you're going to be drinking a lot, but that'll keep you full and hydrated as well. You're going to do great.
Hey guys, everyone wants to get better results faster. Here we talk about at Wellness Key Chiropractic the 3-legged stool of healing. Number 1, adjustments in rhythm to break that subluxation pattern. So if your head is going forward, and it's been like that for 1 year, 5 years, 20 years, right? Certainly a couple haphazard adjustments is not going to fix this thing. So it's that rhythm of adjustments that's going to stop that pattern. Number 2 is breaking the bad habits that got you there in the first place. So going with that forward head posture example, if you continue looking at your cell phone, your iPad, your computer screen, looking down, chin close to your chest, shoulders rounded forward, you're going to continue having that same problem. I can adjust you, I can adjust you, I can adjust you, and we're going to get limited results unless we start breaking those bad habits that got you there in the first place. And number 3 is exercises to help strengthen and stabilize this, so that way it doesn't just keep coming back. No doubt, life is stressful. We're gonna have damage to our spine and to our body, which creates stress in the nervous system. So after the adjustment, also at home, doing simple exercises like lying on your spinal roll to help induce that normal curve for the neck, doing your prolordotic exercises, or some of the exercises that I've given you for home care, all can help strengthen and stabilize the spine to kind of keep you out of that subluxation pattern. I hope this helps. Best way to get results is a three-legged stool of healing.
Green juice. I'm Dr. Utash, this is Nikki, and it's happy hour at Wellness Key.